My name is Joseph Joy, and I'm from Ireland, and I'm in ninth semester in TMA. So the first day of clinicals was quite different because you're usually used to like classrooms and textbooks, and when you come into the hospital setting for the first time, it's quite different to what you've experienced, and the atmosphere is different. You see the patients in real life, different to the cases that you've seen in textbooks, and it's a little overwhelming because like it's your first real life experience with real patients. So a little stressful, but at the same time it's like a new feeling, the feeling like you're actually becoming a doctor. So it was quite different, but it was nice. Every supervisor, every doctor, they're always quite helpful, especially because we're international students, and there's always a language barrier with the patients. So whenever we need whatever help, even like translating the smallest details, the doctors make sure that we understand everything, and they are there to communicate every like doubt of ours to the patient and from the patient back to us. And not just that, during surgeries and everything, they're quite helpful to explaining step by step every process of the surgery whenever they can, and it's always been quite helpful.